Okay everyone, this video will demonstrate how to move a patient from the prone position to the supine position using the manual technique. So the first thing you're going to want to do is gather your help to make sure that you have the correct staff available. You're going to want your respiratory therapist, and you're going to want at least 3 other caregivers, nurses and or PCAs. The first thing you're going to do is move the patient's arms from the swimmer's pose back in alignment with her body, and then make sure any lines and tubing is also in alignment with her body so that it doesn't get trapped under her. If her cardiac rhythm is stable, at this point you'll take off the EKG pads, and then we'll move the patient towards the ventilator in the bed. So all the way to the side where the ventilator is. 1, 2, 3, good. At this point, we'll go ahead and deflate the waffle mattress. As the waffle is deflating, then you can put a chucks over the patient and a repositioning sling right there. We'll go ahead and tuck the patient's left arm under her hip. Again, so when we roll the patient, we're not rolling over her arm. You can tuck now the chucks and the repositioning sling under the patient. This will facilitate turning the patient as we move her. Okay. All right. Again, the respiratory therapist is the one that is going to be directing the turn. That is who is going to be counting. The most important thing is to make sure that we do not lose that endotracheal tube during the turn. So on the respiratory therapist's count, then the nurse or nurses or PCAs on the side of the ventilator will pull the patient up as the other 2 push the sling under the patient and help facilitate the turn. On your count, respiratory therapist.
All right, so we're going halfway. 1, 2, 3. And pause. Everybody good? All right, and all the way back. 1, 2, 3.
Okay. Now you can remove the waffle mattress. You can remove the flat sheet and the chucks that was on the anterior surface of the patient. Respiratory therapist is going to evaluate the tube, see if we need to retape it, and make sure that the patient's in good head alignment. These patients do, as you know, have a lot of swelling in the face, so some ice packs on the face would be beneficial, and putting the patient into a high Fowler's position will facilitate decreasing the edema of the face. All right, and it's just that easy.